Welcome back. Continuing our coverage inside the ICU, and you just saw the strain that the pandemic is having on large hospitals like St. Al's in Boise, but the surge in COVID cases is also impacting hospitals in much smaller rural communities. Smaller hospitals often don't have ICU floors. Some of them may just have 1 or 2 beds to treat patients. But how does that work during a pandemic when the demand for ICU beds is through the roof and other hospitals are full? Our Katya Stepovic went to Minidoka Memorial Hospital in Rupert to find out.
This is slow for us. It's almost like the calm before the storm.
Inside the emergency room at Minidoka Memorial Hospital in Rupert, lately slow days are a rarity.
We've had beds in the hallway here with oxygen tanks up to them, just because their sats are low and they need oxygen now.
While COVID-19 is no stranger to medical experts in Rupert, this Delta variant has different, more aggressive and contagious characteristics, causing resources and optimism to dwindle daily.
It's never been pure chaos like it is now. You know, it just some days when we're here, it's all you can do to get out of one set of PPE into the next, to go to the next room, to try to take a big breath in and gasp and go into the next room.
Kelsey Phillips is the emergency room charge nurse at Minidoka Memorial. She says emergency rooms are constantly full of COVID patients and the waiting rooms are overflowing. The small hospital has 30 COVID beds and just 1 ICU bed.
It is scary because we've never had to do this before. And you know, every life matters to us. And we can only do what we humanly possibly can do with the resources we have. And on top of COVID, we have other emergencies.
Even with the vaccine readily available, more than 95% of patients in the hospital being treated for COVID have not gotten the shot.
You see the wives in the corners curled up crying. You want to, you know, be there to support them, but knowing that they've refused to be vaccinated, you know, it's hard. It's hard to support that because that could have been prevented. This can be prevented.
It's really hard. We still want to help them, obviously. That's what we're here for. But it's, in a way, you know, frustrating that people won't do it for whatever reason.
Tyler DeShock is an emergency physician. He says he's never seen something like this in his entire career, especially when it comes to younger and generally healthy patients struggling to fight off the virus.
I think the last 2 weeks, we've gone through like the same amount of oxygen that we would use in 6 months on a regular basis. I mean, it's just crazy. Like, everything that we have is a resource and it's limited, and eventually it's going to run out.
Because Minidoka only has 1 ICU bed, patients needing higher levels of care are often sent to large hospitals in Boise, Twin Falls, or Pocatello. But those hospitals are also full, and out-of-state hospitals have told Minidoka that they too cannot accept any new patients.
I mean, our whole purpose is to take care of patients. You know, that's our #1 goal, is to make sure that everybody gets taken care of. But when we've got patients that require isolation, you've got a lot of COVID patients, higher volumes of patients, we just don't have the capacity to get people back as fast as we would like to. And we're having to send people home we typically wouldn't. I mean, we've had, you know, patients in their 30s and 40s that are healthy we're sending home with oxygen tanks that we would normally admit to the hospital because they're having a hard time breathing and needed oxygen, but they're just, you know, not sick enough right now to take up a hospital bed. Like, this is my community, this is my people. And to see them getting sick and not being able to help everybody it's tough.
And even if patients do get a bed at Minidoka, they largely battle the virus without the support of their family.
Last week was driving her car around and she got COVID. And a couple days ago, she was really delirious. Her mind, she didn't even really know where she was at.
Brent Griffin is visiting his 94-year-old mother-in-law, who's been in the hospital for 4 days battling COVID. They can't hear her, they can't touch her, and all they can do is wave through a glass window.
To be in a situation where you can't be with them when they're close to death and thinking that they're going to die and they're going to die without you there. I'll tell you, to go just to look through them through a window and try to visit with them that way is pretty hard. You know.
Griffin's experienced this before. Both of his parents were treated for COVID last year at Minidoka Memorial. While they survived,
It was hard on them. They're both, in their late 80s, and not to have family be able to come in and be with them and visit with them and hold their hands and do all those kinds of things, it really affected him. There were many times that he just, really wanted to give up.
Griffin says his parents' lives have permanently changed, mentally, physically, and emotionally. But even if it's not in person, the Griffins get the chance to see their loved ones, which isn't the case for the friends and families of more than 2,000 Idahoans who lost their battle against COVID-19.
It is really hard to put yourself in their position, thinking if that was your husband on the bed dying and you can't be with them or your children can't come in, it's hard to just let them sit there and watch it happen. If they could just walk a day in our shoes, they would understand why we encourage them so much to get the vaccination, because we don't want patients to die. And it's hard on us when we have to kind of choose which patients get treated, which patients might not.
While medical workers struggle to find hope, resources, and the light at the end of the tunnel,
Here we go, COVID, one more day, bring it on.
they show up and protect their community.
Minidoka Memorial is not currently operating under crisis standards of care, but if the trend continues, staff says they're days away from rationing care. Right now, staff are preparing to turn conference rooms into beds.